Hello, how are you today?
Okay, thank you.
You doing fine? Okay, my name is Tashara Fox, and I will be a counselor in training. The purpose for this intake session is for my skills class that I'm taking at Lamar University, and also for my classmates, my fellow classmates to view this, and also my professor. I also want to discuss the confidentiality agreement and what it entails as far as the consent form that you sign and basically what it's stating. So in reference to, um, say if you're in imminent danger or for safety reasons per se, if you possess any harm to yourself or others, the confidentiality agreement has limitations.
Sure.
Those limitations are basically, stating that I will have to inform by law the parties that, may be able to assist in other ways to, look out for your care and safety as well.
Okay.
Do you understand the consent?
Yes, I do, ma'am.
Oh, okay. So I also want to get into a conversation and begin session by saying thank you, first of all, for volunteering with me.
Oh, sure, it's a pleasure.
Absolutely. So what brings you into counseling today?
Well, unfortunately, I was feeling the symptoms of depression.
Okay.
I started feeling different. I have changes in my life, and then I was told that probably I have the predisposition to depression, and the trigger was when my son has to uh, leave home to go into college,
Okay.
and then that was a trigger who definitely make my onset.
Okay.
Right now, I am in treatment.
Okay. So what I hear you saying is that most of your depression is caused from your child being able to leave, well, going to college.
Yeah.
And so would you say that you're experiencing like the separation anxiety
Exactly.
with him going off to that new experience?
Yes, this is exactly what happens, and probably because I had the depression, but it was not a trigger to push it to become noticeable symptoms.
Okay.
The departure of my son
Okay.
was the element to make it to be more noticeable and then affect my everyday life activities.
Okay.
Yes.
Well, I want to ask you, what are some things that you have prepared for yourself before your son went off to college? Is there anything that you prepared, mentally, prepared for your son going off into this new journey?
Yeah. Well, to say the truth, as a parent, I just not even want to think about that because I didn't want that this day come true,
Absolutely.
I was in the denial that the time was going by, and either I prepared or not, the day was about to come. To say the truth, I didn't do anything, and that was the reason that when I faced my reality, that was shocking and then pushed my depression up.
Okay. So have you spoken to anyone in your family as far as like natural supports in regards to how you're feeling before you came into counseling?
Well, yes, I talked my older sister,
Okay.
who she went through the same experience when her son, he went to the army.
Okay.
And she was telling me how she was feeling, but she remembered that probably she was not in the predisposition of being depressive, so she just managed it as a mom having a son out of home. In my case, the depression just triggered out my symptoms.
Okay. Okay. So let me ask you, as far as your depression, have you sought out services for perhaps a psychiatrist for medication, or is it just something that you're dealing with therapeutically on your own?
Oh, well, yes, when I see that the symptoms was affecting my everyday life, I had to look for professional help.
Okay.
I went to visit with my doctor, and
Okay.
then the doctor gave me a prescription, a
Okay.
referral to going to the psychiatrist,
Okay.
and the psychiatrist confirmed that I do have depression, so this is what I am right now.
Okay. And so I definitely understand your concerns with depression. Depression, at times you don't know where it may come from. Sometimes you have to expect the unexpected. However, I know that what I'm hearing you say is that you're at the point that it's kind of difficult working through it on your own, and you want to be able to speak with someone in reference to finding a solution to that, helping you work through your depression besides your medication. Is that what I'm hearing?
Exactly.
Okay.
Yes.
Okay. And I certainly understand your concerns. So I would like for us to, well, I want to help you in a way to help you utilize maybe some techniques to help to calm down those depression feelings, or if it's, thoughts that are running in your head as far as like isolated, because I know sometimes when it comes to our children, it's hard to let go.
Right.
But I would love to perform some techniques, some coping and calming techniques with you, if that's, something you would like to do.
Sure. Thank you.
Okay, I would
Appreciate
love
it.
to. Oh, absolutely, absolutely. So what I would like to do is next week, well, before the week, if it's, something that you can practice, like breathing techniques,
Right.
sometimes breathing techniques help us to really just calm those nerves down. And sometimes it helps us, like if we can close our eyes and not, have to focus on how we're feeling as far as being depressed, but just kind of give ourselves positive affirmations.
Right.
Try to think those happy thoughts that, can help you to calm down while you're doing your breathing exercises.
Okay.
Is that some homework you would like to do?
It sounds like a plan.
Okay,
And I
that
hope that they
sounds
can
great.
help me.
That sounds great. So I want to schedule next week
Okay.
for us to meet again, and then I want to see, I want us to revisit how those techniques are working for you.
Okay.
And then I also want to know, like, certain goals that you're trying to set forward into helping you cope with your depression.
Sure.
And, hopefully we can have a better outcome. I feel we will have a better outcome.
Sure.
But I
Sure.
would love to meet and schedule for next week. And
Yes, ma'am.
I'm looking forward to seeing you.
Thank you, ma'am.
Absolutely.
Thank you for having me today.
Absolutely. It's such a pleasure.
Thanks.